Okay, so it's 1 o'clock on the East Coast. Let's get started. Don't want to penalize the people that are so punctual. Good morning and good afternoon. This is Jim Gerson from CareStack, and I'm happy to host you today for our webinar along with my panelists, Cobo, Oviedo, and Dr. Aman, Kaur. And as you can see on your screen here, the title of our program is your new productivity playbook, making the most of your time while your patients are on pause. So Dr. Kaur, if you want to advance, that'd be great. So just a couple of housekeeping items real fast before we get started. As you get situated, just know that you're intentionally on mute. I know there's a lot of questions around, you've seen probably some of these epic Zoom fails that are happening this week, but we've intentionally placed all of you on mute. But if you do have a question, please use the little chat feature at the bottom of the screen where you can ask a question. If it's relevant and germane to the specific slide that we're on, we'll do our best to answer it as we go forward in the presentation. But understand that we built in time at the back end of this presentation to having a parking lot for questions. So feel free to use that feature. I'll do my best job to ask all these questions. So again, back to our, just a little bit of background on who's involved as sponsors. I represent CareStack. I'm the Vice President of Sales and Marketing. We're a all-in-one cloud-based solution for dental practices. And I think what's really unique in this time, in this age, is it allows you to work remotely and do everything as if you were in your practice, whether that's charting and scheduling, submitting claims and so forth, or handling patient engagement. So that's the only commercial you're going to hear from CareStack. Thank you for hearing me out. Our other co-sponsor for this program is Darby Dental Group. And Darby is one of the nation's premier dental distribution companies. And they focus really on becoming a true business partner with their clients. What I think is unique about Darby is, number one, they've been in business for over 77 years, and they've weathered some challenging times. And really, what I look at them as being a great partner is they bring together, the traditional supplies along with solutions that can be oriented to your practice. So if you're in a position of, I want to grow my business, I want to maintain it, they're really a great organization to work with. And I want to thank them for co-sponsoring this presentation today. So let's move forward and introduce our panelists. I gave my introduction. I don't think anyone else wants to hear from me. So Cobo, I'm going to turn it over to you. If you can give some background and context about your participation in today's webinar, that would be great.
Yeah, thank you, Jim. So yeah, I'm Cobo. A little bit about myself. I've been in the dentistry space for about 8 years now. I actually started in dentistry from the ground up. I worked at a call center for Heartland Dental, and from there onwards, I've learned a lot about operations, management, people. I've learned the importance of systems, processes, and building teams of like-minded people. Currently, I'm working for Nova Dental Group as an operations manager, and I manage a few locations in the Midwest region. I'm really grateful to be part of a group that understands the power of communication and growth. And I'm excited to speak today about some of the things we put in place during these rapidly changing times, due to COVID-19, and to share how we've been able to keep our teams together and focused.
Great, thank you, Cobo. Really appreciate it. Dr. Aman, Kaur, why don't you take us away, please?
Sounds good. Thank you, Jim. My name is Aman Kaur. I am a dentist by trade, and I've been very fortunate throughout my career to work with some great clinicians and amazing organizations. Some dental offices I worked for were named best in nation at a time. I have ran some dental assisting schools, worked with a lot of small groups, large groups. Recently, mainly been working with 60 million plus revenue group sizes. So some of the common names I worked with are Aspen Dental, Samson Dental, and currently I'm part of AIM Dental Alliance. It's a group of experienced dental professionals put together that work with all sizes of dental offices, small, large. And the real goal here is to just empower the entrepreneurial dentist spirit and keep empowering them, and whatever gets in their way to become a barrier to what they want to do, we take care of those services with them. And at AIM Dental Alliance, we are in 4 states, and our services include marketing, public relations, provider recruiting, small things from accounting to large things growing through de novos or acquisitions. We have an amazing integration team, really proud of them. So that's what AIM Dental Alliance is. And today, I don't want to say I'm excited about this webinar, to be honest. A month ago, I didn't even know I would be doing this webinar. No one wanted these times to come, but we are here. So but we are here. It's like a football player, a performer who can't perform, and we just don't know what else to do. That's all we are born to do, and we have been doing. So nonetheless, we have to take this time to get ready for the game. So my goal today is to talk about different things we can do to get ready when it's go time, and when it's go time, we are ready to play. So, I'm going to talk a little bit about situation at hand. What do we need to do? How can we prioritize different tasks, our people, ourselves? And what are the things we need to do to keep our patients engaged? Because it has taken years to build these practices. We got to maintain them. We don't want to start from a ground up point once it's all behind us. And it never rains forever. It will be behind us, and we need to be ready for that. And I know a lot of organizations have great growth plans, even small offices. They want to add a specialty. They want to open another opportunity. So how can we stay on top of those growth plans? So these are the areas I'm planning to cover today. So situation at hand, there are dental offices closing or only open for emergency hours. In these times, there is a lot of things to focus on. So first and foremost, I personally believe our largest and our most precious asset is ourselves and our team members. And you've got to stay connected. If you are a larger group and you have your immediate team members, which are your office managers, your associates in every practice, and even if you are 1 or 2 practices and you have an associate, you have a hygienist, you have your office manager, stay connected with your immediate team members. And I am not going to bore you because there's so much information on web today, how to stay engaged and connected with your team members. I'm just going to highlight a few things that I think are so important to remember. Remember your team's development. And in the past, you did not have that time to give to your team members to develop them. Take this opportunity, help them develop, give them the gift of your time, and try to do some informal virtual meetings. Informal meetings, they are not mandatory, they are invitation only. It can be a lunch hour. You all have lunch together and just talking about how they are feeling, what they are doing. Those can be raw conversations, because I fear otherwise you're having meetings, have an agenda, stick to it, but informal meetings and your team development, do not forget that. You all are great about setting goals and all these other things. So these 2 things, I think, are a great use of time to get to know your people and keep developing them. Similarly, at practice teams, there are a lot of things people can do. I'm going to have Cobo talk about what he is doing to keep his practice teams engaged, because he has done a great job. And I have seen his team just raving about how they are going through this time together with him. Cobo, if you don't mind sharing this.
Yeah, thank you, Dr. Kaur. Yeah, and I kind of just wanted to build on what you said about, staying focused. Working remotely for me is new, as you know. So setting daily goals for myself and staying focused has been the key to get things accomplished. But with practice teams, I'm trying to bring in the same mindset of setting those goals and staying focused. One of the things I would highly recommend is the virtual team huddle. You can use FaceTime if it's a smaller group. You can use any platform really that you'd like, to check in on your team and really just plan through your day. Work on individual and collective goals. Being connected with your team really goes a long way. and, just ask them, how are you doing? What do you need? And genuinely listen and provide support as much as you can. One of the other things we're doing is we're constantly checking and updating the intranet and team forums. We have information on there about what we're doing as a company at the leadership level to ensure we're financially protected. So definitely, keeping those updated is really important. Another one that's helped me tremendously are the team challenges. Some of our offices are more active than others. So for me, like I said, I'm at home, I'm working now, I don't have a routine. So, being part of these team fitness challenges is a good way to help keep, not only my body and mind in tune, but my team members as well. Other challenges you can put in place can be, centered around practice operations. For maybe all of your practices, one or two, you can do AR, an AR competition, or maybe teledentistry competition. If I had time is something you hear every day. We all have time now, so we got to make it fun. And lastly is the visual education events. I have lots of managers, that I work with who are good at a lot of things. But one specifically, she's great at treatment planning. So what we had her do is we had her get on a webinar, just like we are, and she was able to present her treatment just like if she was doing to a patient. She was able to get feedback, ask questions, and we have this luxury of time now. So I'm seeing a lot of amazing things happening.
Awesome, thank you, Cobo. Yeah, I think virtual team huddles, it's a great way to get teams excited in the morning and get focused. Mm-hmm. So as we are talking about team members and your practice leadership, please take care of yourself. Don't forget yourself. This is our opportunity to use that part of our brain that we want to use. There are hobbies we wanted to pursue. And some quiet time is going to bring us a lot of clarity and focus, especially as the times are going to change. The world is, this pandemic is going to shape the world we are going to live in going forward. So it will be a great time to focus on all the things. There's so much information online, on TVs. So it is time to pick what you want your practice to be about, your business to be represented as. So take this time to gain clarity and get focused on a few things and just get to them. Social image of the practice, it is a lot important. It is changing, and as situations evolving every day, there's so many updates that needs to happen. There is a lot of information out there, and we have done few things that have worked well for us. I'm going to have Cobo share some of the things. Cobo, if you could share things that have worked well and that have been successful.
Yeah, definitely. Thank you, Dr. Kaur. So, the most important thing is, your practice, your office may be closed right now, but your online presence and offline presence are still open. So now's the time to be, active, be engaging, and really, online, you can make those website updates. The situation's changing daily with COVID-19, so making sure your patients stay updated is definitely number one. Now is also an excellent time to provide patient resources. What to do in a dental emergency is a topic you can cover, or just at-home preventative care for those perio or general dental periodic patients. If your hours have changed, you definitely need to keep your patients informed on your Facebook and Instagram, website, those kinds of things. And if you're offering teledentistry appointments, share that information with them. And then offline, a couple of things we've done is, we put up some signs about what to expect and some of our protocols about what we're doing once you enter the office. We've put in a virtual lobby at most of our locations. So making sure that our patients know that we're doing these things is really important. So when we make those confirmation calls, leaving those messages, we make sure that our phone scripts are up to date and, patients are staying informed. So informed is the key to really all of this. And, make sure we're telling them, this is what's going on. We're here for you. And, you know, if those patients have some elective procedures, to kind of hit on the build the future schedules part there, if patients have elective procedures and we have to push them out, you know, talk to them, call them, be personal, because when that time comes for them to come back, they'll really remember, you know, hey, you know, Jane took the time, or Joe or Cobo took the time and spoke with me, kind of, you know, let me know that he's here for me, even though, you know, we got to push you out a little bit, and they got to push me out a little bit.
Hey, Dr. Kaur, if I can just jump in here for a moment and just kind of confirm what Cobo is saying. Something I'm hearing from a lot of offices and what our clients tell us is they don't want when they do reopen their doors, they don't want their patients to be alarmed or the first time they're hearing or seeing something. So this is where you can use the personal touch like Cobo talked about, but also use your reminder system to educate patients on what the new normal is going to look like in your business. For example, if the waiting room is going to have, you know, chairs distanced out appropriately, things like that, things of that nature.
Yeah. Actually, Jim, it's a great question. And, you know, we don't want our patients to be alarmed, but guess what? They are alarmed. We just need to show that we are prepared. We are not naive to the reality. We got to show we are prepared, and people, there is so much information. In some cities, even in the parks, I am constantly seeing announcements to practice social distancing. So it's not just TV or media, it's everywhere.
Right.
So people are alarmed, and we need to let them know that this is a place where they can be comfortable. There's no more sterile place than a healthcare facility. We are trained to take care of them, and we are going to take great precautions to make sure they are safe, our teams are safe, and making them part of that journey is a positive. Okay, awesome. So just I want to build on what Cobo was talking earlier. Sharing these images, we have been sharing those images on social media that we are cleaning chairs. We are using very stringent disinfectant protocols because people need to see that you know, we are prepared to take care of them safely. Because people, we don't want them to be put off by coming to a dental office. A lot of people are scared right now, so we need to address that. One of the things we are doing, which I am really proud of, is helping patients understand what is dental emergency. And if needed, maybe take care of some basic, what to do in case of dental emergency. It can be taking some pain medication and reaching out to dentists. We really want them to come to a dentist when there is a dental emergency instead of going to an ER or a healthcare. So we did some videos around that with the doctor talking about it is really helpful. So going on to the next topic, a hot topic, teledentistry. There are so many mediums. ADA has done fabulous job putting out the information, how to go about it the right way. A lot of insurance companies are covering some of these codes as well, and emergency exam. So I'm not going to talk a lot about teledentistry. There's a lot of information out there, but I'm just going to remind a few key things. If you're offering teledentistry, make sure it is known to your patients that you are offering teledentistry. And is it around the clock? Is it just specific hours? List those. And when you're doing teledentistry, pick a HIPAA compliant platform. Most of them are based on ADA has listed the approved ones. Pick a HIPAA compliant method. And it is not an appointment just with the patient and the doctor. Don't book it for 15 minutes. You need to make sure patient has completed all the forms. You have copies of their IDs, created a true patient account. Send them the necessary forms they need to sign before coming in. If it's your financial arrangement agreement, your HIPAA information, send them out. Get all those signed. And then right now, patients are doing all these things remotely. So make part of your teledentistry appointment first should be where your practice manager is talking with your patient, welcoming them to the practice and letting them know we are here for you and we're glad to be able to help you. So don't miss all those things. Jim, you have a question?
Yeah, Dr. Kaur, I have a question from the audience actually on teledentistry. So I hope I'm representing this right, but what are some of the pitfalls of teledentistry that a practice or a clinician should be, mindful of or concerned about?
Yeah, so pitfalls are, I'm glad you're asking, because there are some. People are not trying to differentiate what method they are using. Is it for a face-to-face appointment, or you're just going off the record? So using a proper coding is important. And whatever information you're sharing, even a lot of offices are not getting the HIPAA forms signed by patients. So getting all those forms, consent forms signed, and proper documentation is the key. And if you're taking any pictures or patients have sent you some records or x-rays over the email, make that part of patient account. Don't leave them hanging in your inbox in emails. So all those things need to come over. And when you are doing and what proper documentation look like, it has to be listed what modality are you using, what was the date and place of service, details of conversation. So if you have notes templates, update them to make sure it reflects the teledentistry. It was a teledentistry appointment. And
I just want to encourage people. We've got, please use the question and answer box. I do have another question. Do you mind if I bring it up here, if that's all right?
Yeah, absolutely.
So the question is, are your patients paying for this visit up front, or are those visits being submitted to insurance?
So we are collecting from patients based on their insurance, and these D9995 and D996 code, these are kind of up in the air if they'll get paid or not. So we are collecting for these services before the appointment starts.
Great. Okay. Let's keep going. I know we got a lot of content to get to. I'm sorry. I'll keep some of these for the parking lot for later.
Okay. Sounds great. And going into is financial well-being of your practice. These are tough times, and we have to navigate through a budget to get to that, what is that bottom line number? So A is to say, okay, we are not going to have revenue and we are cutting hours, great. But these are also the times if we want to keep our teams engaged to some level and get some projects done. So we have adjusted our budget, even though it was whole annual budget was approved, but we have gotten to a point where we will still be able to maintain our net income goal. We have taken some additional measures to ramp up our collections from old productions. And there is not a similar marketing expense. So please make sure if you are paying for any ads, kind of adjust those based on your current environment right now. And the fixed expenses, if you can push them out, talk with your vendors, your landlords, they're helpful. There's so much information out there. And I think, Jim, there is more coming up in the next upcoming webinar around that too. So work through those things, but this is the time to get your collections to as good as it possibly can be. So work on that. And if you are using any revenue cycle, any collection agency company, work with them closely. They are making it a real focus. So now going from financial well-being to task at hand. First and foremost, retain your patients. Your patient campaigns now need to be very different. So one of the things we have implemented is we have divided our patients into 3 categories based on their age. Pediatric patients, especially the recall patients, these are the procedures that are not dental emergencies. So pediatric patients, adult patients who just need regular prophylactic cleaning, and periodontal patients. So starting with pediatric patients, we have started to share with them virtual high fives and virtual kudos. The other thing we are doing is we are sending them letters which are going to help them, personalized letters, how to brush your teeth for proper 2 minutes. And we are actually sending them the stickers they would have received if they would have come to the office. So they feel like they're still on the office, they're on the track. We just want to make sure they stay on track. For adult prophylactic patients who just needed basic prophylactic cleaning, our letters are based upon how to keep their teeth clean in between appointments, and we have made personalized calls to them. A lot of our patients are enrolled in Whitening for Life program, where they came in and received whitening refills every 6 months. So we don't want them to miss out on those whitening refills. We have called them, and a lot of them have come and picked up their whitening refills. Of course, we talk to them to make sure there is no decay or other things going on. But this is the time to check on them and make sure they have the dental hygiene supplies, and if they want to come in and pick those up, these go a long way. And those calls need to be personalized. Hey, last time you were here, we talked about acid reflux. How are you doing? Okay, stay healthy. And we are pushing your appointment to May 15. You think by then it'll be okay? Yes, it'll be okay. In the meanwhile, please come by to pick the hygiene supplies. We want to make sure you stay on track. So these are the kind of personalized approach we are doing to make sure we are retaining our patients. And our SRP patients, periodontal maintenance patients, these are the patients we have focused with them a ton about techniques of flossing, because flossing is the best resolution. And going forward, I think if we have talked about oral systemic connection in the past, this is the time to keep focused on that, because people are focused on their immune health, their immune response, and this virus is here to stay. I mean, we know that. So we need to make sure our patients are prepared to take care of themselves. And oral health is the gateway to body, because they need to have healthy teeth to have good dietary habits. So a lot of emphasis on oral health. It's going a long way, and patients are really receptive to it. Finally, patients for pending treatment, we're staying very individualized with them as well. We are sending them links to what their treatment, what their problem was, and if it gets worsened and they want to come in sooner, we are sending them informational videos so they understand that what it is and for how long they can put it off or not. And these are conversations. It's not, oh, we can't do your treatment, let's push someone just calling you and moving you 3 months out. Talking to them, are you feeling okay? Are you practicing good oral hygiene? Is the tooth hurting? So it's a very tailored approach, and I believe this is the time when we have to be more than patient communication, and we have to be a resource to our patients. So Cobo, do you want to take a brief minute to talk about some of how patients are responding to it, because you are right there?
Yeah. Thank you, Dr. Kaur. Yeah, so this has actually been a really rewarding experience to do as a practice leader. From what I've heard and seen, my teams are feeling connected to their patients like never before, and patients certainly did not expect it, and they've been pleasantly surprised. So, that personalized, tailored touch really does go a long way.
Okay.
Hey, Cobo, this
awesome.
is Cobo. Sorry, Dr. Kaur. We have a question. I think it's appropriate to this slide. And by the way, there's 2 questions in teledentistry. We'll bring those back into play here at kind of the end of the presentation. So Cobo, I think this is a question more for you from maybe an operations standpoint. In delivering videos to these clients, are you able to personalize them? Talk a little bit. The person asking the question asks, how are you delivering those videos to clients, and are they personalized?
Oh, yeah. So, so one thing we've done is, if you have an iPhone, somebody on your team has to have an iPhone, and it's super user-friendly. So that's actually what we've been using. I've been using this in iMovie. So just shoot the video. You can have your staff members talking and then write a little script for it. Throw your logo at the beginning, maybe some music. Nothing too fancy. It probably took me 10 minutes to make a personalized video, from start to finish. So it's really simple. Use the tools that you have. Definitely fun.
Jim, even if you're sending in the email, you can use the YouTube video links. So it's not
Right.
something you created, no HIPAA, no other violation. And we are taking really this time to make sure our teams are engaged. So we are doing a little differently. A lot of our doctors are talking about why they like doing root canals, why they're good at as our future marketing campaigns too. Mm-hmm. So we have been able to pull some of those things, but if you don't have that information today, just go to YouTube. There's so many amazing links. Your vendors have so many links specifically about the materials you're using. Just giving those links to your patients, they understand the depth of treatment and procedures.
Great. Thank you for speaking to that.
Yeah, my pleasure. So big question is, what do we need to do when we are ready to reopen? And we are going to open, so, but it'll be, virus is not going to just go away. It comes May 15 or May 1st. It may be still lingering around and certainly on people's mind. So new sanitation protocols, whatever you guys have implemented more of, change your disinfectants or frequency of those, highlight those things and make sure they are somewhere listed and your team's well trained on it. Continually social distancing, for that you might have to implement new scheduling model templates where you don't have more than 3 patients in the practice, more than 1 patient in the reception area. How you conduct yourself, you don't bring 2 patients for checkout at once. 1 patient checks out, you wipe down the counters, and then the next patient comes in. So there will be some changes, which means you might have to expand your hours or shrink your hours. So talking about those things ahead of time and being prepared is going to be very important. And you might have to go slow to go fast, honestly. If you're going slow, you're taking your time to make sure there's great infection protocols and those infection protocols are communicated and understood by your patients. You're still making your patients wash their hands as they come in, wash their hands as they leave the practices. So there is more time. But, sometimes you have to go slow to go fast, and this will be that time. And you have to update your appointment reminders, their scripts. What your team members are telling patients, what you're sending via text messages or emails, to reflect what to expect from when they come into the office. So no one is surprised, no one feels discriminated. I'll share a story. We had one of the Asian patients, and we are making everyone wash their hands. And it was a strange reaction on that patient's face. But when we talked about this is what we do, this is our protocol, it was much easier transition. So, we don't know what people are sensitive to. So just more communication and clarity is the name of the game. With your team members, with your patients, can't emphasize enough on that. Finally, prioritizing tasks at hand. So we have, like every other organization, I just have a quick glimpse of what we are working on. We are working on adjusting our budgets. We have our reporting calendars. There are a lot of things we are working on, but I would say that all the clinicians right now need to work on, this is the time to update your clinical notes, update your consent forms. And if you have new providers, you wanted to work with them on treatment planning or giving them a review on their work, this is the time to do that and make it really meaningful. You can use any virtual meeting platform, and these can go a long way. And if this is the time to work through some of the IT updates, I mean, if we learned anything, our reliance on technology. If you need to do a software update for X-rays or EMR programs, this is the time to do it. And we are working on reviewing our formularies for supplies because we need to incorporate a lot of these high disinfectant things, and it might be expensive. So what else can we stabilize or consolidate? So this is the time to go through a lot of those things, and we are working on it. So one of the things we as a company, we are working on, and I'm very proud of, is we are working on our new practices integration playbook. So if there is anyone growing through acquisitions or mergers or partnerships, this is the time to do it. And then because as you go into growth mode again, it will make it seamless. You will be saving time. So that's one of the projects I thought I'll share. Marketing projects. So marketing is going to be so much different than what it was in the past. You might not had emergency dentist or dental emergencies in one of your words in the past. You might need to incorporate that, because that might be the way patients are going to even prioritize dental health. As dentists, we are not naturally good at marketing anyways. And we feel we are competing with other dentists, but in reality, we are competing with other things in patients' life, their travel plans, their dinner plans. We are competing with a lot more things just than other dentists. So this is a time to really talk about importance of dental care and oral health. So working on your external and internal marketing campaigns and building your teams around it. So what you are putting out for your customers is also part of your culture right now, is going to be the key for future marketing successes. So how we are approaching this is we have made our monthly campaigns for social media, for websites, for internal marketing, and we have designed them, and we have picked healthcare themes. So April, Oral Cancer Awareness Month. May is High Blood Pressure Education Month. June is Men's Healthcare Month. So we have picked those forums and worked around that, what will be going on our social media, what will be in our blog, and what will our teams be talking about. So this is the time to get ready for as far as you can, and we want to stay relevant. So keep it around health, overall systemic connection of oral health, and staying on top of your patient's mind for what you're doing to protect them. And in our marketing, we're also talking about different things we are implementing so they are protected. Air filtration systems. There are some amazing ones out there. Talk to your vendors. And focus on patients' health and safety, can't say enough, especially who have diabetes or any other health conditions. They want to know you are thinking of them, and individualized approach for them.
Dr. Kaur, 1 second here. Just let everyone know we've got about 4 questions in the queue. We're gonna address those here. We've got probably about 7 or 8 more minutes of the presentation, and then we're gonna answer these questions and more. So we do have time allocated for that. Thank you.
Great. Thank you. There's other things we are working on, HR and training projects. As we all know, there have been some changes in the team members we had. Some have been on furlough, laid off. We don't know if they'll be coming back. We don't know if they'll be staying in dentistry. So this is the time to get your job descriptions updated. And I have worked with many different groups, many dentists. I have noticed anytime they are ready to open a job position, they have to rework their job description. Update your job descriptions, especially now you're going to expect different things from your positions. So I can make a room for that. Create a career progression plan. People want to know that they are joining in for a career. It's not going to be a job. So your standard operating procedures are more important than ever before, especially if you will be ending with new employees after this all is settled. And maybe even after they come back, it may not stick. So have your standard operating procedures, good onboarding programs, even for clinicians to bring on associates. Get those lined up, because they are the most important part of your practice. They are your partners. And having them aligned with you is the key. And future dentists, the newer generation coming out of dental schools, they like to know. And they like to know it as a put together versus going with the flow sometimes. So have all those things lined up. We are really focused on recruiting dentists right now, because there is a huge group of dental students in school. Coming out of school, a lot of dentists laid off, and they are uncertain. And if you're recruiting dentists, you know it takes almost a month to get to an agreement and 3 months to get them credentialed and ready to go. So this is a great time to talk about those. And in your recruiting strategies, incorporating how you're going to be by your employees when things may not be great. It's important to them. People are asking about it.
And I would just add to that, you know, dentists are asking more about that now than ever, right? They want to make sure they're working for an organization that has a plan for the rainy day. This has made them aware of that. So thank you for speaking to that.
Yes. You know, it's a challenging time. Like I said in the beginning, Jim, no dental school education, no business school education ever talked to us about how to go through these times. We all are learning, adapting, pivoting as fast as we can. But there are a lot of lessons, there are opportunities. Some organizations have done an amazing job bringing teledentistry, bringing COVID-19 testing in their workflow. Kudos to that. And, you know, stepping up as a healthcare has been amazing to see from some of the dentists. So a few lessons for us have been our reliance on technology. It became so very clear. So all that computer, you know, it's still working. So what if it doesn't do these two things? We can push it off. So it became clear those investment in technology is just necessary. It's not a I want to, it's a have to now. And your team members and you all have a lot of skills. We learned a ton, and those skills, they don't get to show probably in their day-to-day life, but we are learning a lot of our people are really good at marketing techniques. They're really good at building trainings. So we have been able to pull out of great talent, which we never thought existed there. And, you know, we can't go through anything together well. So teamwork has been really important. And financial priorities, we want to get to a point where our organizations are sufficiently healthy. So if these turmoil or these troubling times ever hit us again, we can still hold as an organization for some time. So thinking through that, being prepared for that, creating that rainy day fund has become clear for us. And overall, appreciating for health, oral health is great. I think this is the blessing for this industry. We have to step up as healthcare providers, because we are. And above all, stay nimble, be nimble. You have to adjust, adapt. I have done this worked out well, is not going to serve us always. More flexible, more adaptable, more nimble we are, more longer we will be around. So that's what my takeaway is from this situation.
Thank you for speaking to that. That's great. Well, I'd like to, Cobo and Dr. Kaur, thank you so much for this presentation. We're going to open it up here in a moment to questions. Can you just fast forward for a moment, if that's okay, Dr. Kaur, to the this last slide? I know we're going to have some questions that are going to talk about the financial component of getting some more clarity. I'm pleased to announce that Darby and CareStack are sponsoring a webinar on Thursday with Clifton, Larson, Allen and partners. These two gentlemen down here are going to speak about accessing stimulus funds considerations from the dental perspective. So if you do have questions about that, we're going to have a separate standalone webinar next week. But I want to go ahead and Dr. Kaur and Cobo, I'm going to go through these questions as they came across chronologically, if that's all right. So going back to teledentistry, how do you set teledentistry right now in your practices? And, what would you recommend to those out there considering it?
So we are on CareStack platform. It allows us to be able to access it from our homes, and our doctors are able to access these from home. So we have set up a Zoom link. Zoom meetings are we using. We have set up a link, and we actually provide a unique meeting ID to every patient. So we are not using the same meeting link, just to make sure we are protecting them, because you never know once it's out there. And we put all that information in the documentation. So patients are calling us. We advertise about teledentistry all around our social media, websites. That's where we started. We sat down internally as a group what this is going to look like. So all those appointments are received. They're going on schedule as teledentistry appointment with a different production type. We created a new production type so we can see how many teledentistry appointments are happening. We let the patients know what it's going to be financially mean for them in advance, so they are prepared for it. And we are taking, we have a way to take payments over online. So we just send them to that portal, they pay for it, we schedule appointments, and they start with the practice managers. They sign them up, they go through all the forms, documentation is completed. Then we we actually text the doctors, and doctors join the call. So there's always a manager and doctor present on the call.
Thank you for bringing that up. And maybe, Cobo, a question for you or the doctor too as well. Are you collecting UCR on these? What's the strategy for these teledentistry calls?
Appointments? So we are collecting UCR, with the knowledge, sharing the knowledge with the patient that, these codes really are still up in the air. Some insurance companies are covering them, some aren't, some have different restrictions. So, at the end of the day, it's just like any other procedure. You tell them, this is the estimate, this is what we're collecting. Of course, once we get that explanation of benefits back from the insurance company, if anything changes, we'll let you know, we'll keep you updated. But just being open, clear with the patients really goes a long way.
And in reality, patients are really pleased to get the care they need at the time they need. And from these teledentistry appointments, they may become your emergency appointment for the office. And that may be the time to, where finances all end up working out. So on the teledentistry, we are asking for UCR fees, and patients are so far pleased to pay.
Great, appreciate the background there. I'm shifting gears here. When we were talking about, the new standards of, waiting office hygiene, for lack of a better expression, there was a question from the audience for someone who has an orthodontic practice. And in his practice, he mentions that he sees patients from 2 to 6. And Dr. Kaur, do you think it's reasonable to ask his patients to wait in their car because it's such a consolidated amount of time? You wanted to get your thoughts on that.
I think it is great to ask them to wait in their cars, because in their cars, they are with their family members, they're entertained. They can use their iPhones or any tablets to watch some videos. Kids like spending time like that these days, and they can be at louder volume if they want to. Instead of all trying to find a way to feel safe when they are really not safe. It's just not good for them to be cramped up in a space. They're in their own cars, they walk in, you take their temperature if that's what you're doing, you make them wash their hands, take them back. That's the way to do it. If you need to expand your hours, just so you can keep that flow of patients, it's not too many patients in your rooms. If all the rooms, I know a lot of orthodontic offices don't have those walls between them.
Right.
Social distance, there's no escaping social distancing, and there's no need to take a shortcut on this. So maybe you might have to expand your hours. I mean, I hate to say it like that, or shrink the volume of patients you're seeing.
No, I think the candor is appreciated. So we have a question here about going back to teledentistry, and I do want to mention everyone, because there's a couple questions that have come up. Everyone who's attended today is going to receive a link to the actual program itself, and then it will be housed on the CareStack website under resources on the CareStack website. So if you missed something and you want to watch it again, you can either request the link and it'll be emailed to you, or you can go to the CareStack website and access it there. So going back to teledentistry for a moment, and then we'll finish up with one more question. You're doing that through Zoom. You confirm that, right? You're using Zoom
Yes.
as the mechanism? Great.
Yes,
And then I guess the question is, can you go through the process more to clarify it? I don't. That's what the listener has asked. I'm not sure if you can put a little more detail on that.
Happily. So first and foremost, advertise it. Let your existing patients know via email that this is what you're doing. And if for new patients, have information on your website so they know there is teledentistry is an option. A lot of patients don't really know about teledentistry. So when patients are calling, they're calling with emergency, and you let them know, hey, these are our emergency hours. But before emergency hours, we do offer teledentistry to make sure if this is something we can help or manage over teledentistry, we want to do that. And a lot of times patients need those antibiotics or painkillers, so you can take care of a lot beforehand. So that's how we talk about when we are receiving those phone calls, and we explain to them, patients, this is the process, this is the software we will be using, and these are the links for you to download on your tablet. We walk them through everything. So that takes time. These are not quick appointments. So that's a huge part of letting patients getting ready and help them getting ready for that. So once they are ready, and then you actually start, let them know we will be seeing you at 9 a.m. on Tuesday, and I will be the first one talking with you. We will go through all the forms you will be filling beforehand, so you know what that is, and this is our fee. I will be collecting that on that day. You direct them to a link where they can go ahead online and pay, and you know that you received the payment. Then we do the medical dental history update on that day, because we do want to talk about even these screening questions for COVID-19. Are you experiencing any of those? We have incorporated that in our notes. And that's when we say, all right, seems like we are all set. Let's bring the doctor on. And he might want to ask you about where is it hurting, for how long. And sometimes if they have x-rays from previous doctors, and if there are patients, we pull those up. So it's been fairly seamless. So hope this helps.
Yeah, definitely. Thank you for giving the clarity to that. Yes. I think we have time for one more question, if that's okay. So, and this looks like it goes back to your conversation, and maybe Cobo, you can speak to this too as well. Do you have a template for onboarding that you can send out? And I assume that means onboarding, team members, right? And again, I don't know if this is your intellectual property or if you want to speak to this, but that was a question from the audience.
We do have a template. We have template for all positions, and that's what we serve a lot of our partners via AIM Dental Alliance. But we can, whoever needs help, they're welcome to call me. I can share my information if that helps.
Yeah, if you want to bring it on the screen, do you have it on a slide here, or you can bring it up on the screen?
Yep, right here. So please feel welcome to email me.
Oh, we just see it. Yeah, we don't see it. We just see. Oh, yeah, there you go. Under your name. Yes, perfect. Aman Kaur, one word, at aimdentalalliance.com.
We are happy to help. I have been in this industry for way too many years, and I've seen some great people. I love to help however we can, so please reach out.
And I think we have a time for one last question here. I'm now trying to stock up on masks and gloves. This is proving to be difficult. What should we do as healthcare professionals? What's a strategy for this?
So
looking forward to reopening, I guess. Yeah.
Yeah. So we, actually vendors have done a great job. They have limited two boxes per week. So we have been ordering based on what we needed. And there's a tremendous increase in supply going forward. So hopefully we are not using N95 masks. I'll be honest with you. They were not available. We are double masking in our offices, and we're making sure patients, N95 masks are needed if someone is COVID-19 positive. So we're using double masks, the traditional masks, and stocking to make sure you have enough supply is the answer. And work with your vendors. Vendors are really good about making sure you have sufficient supply.
Yeah, exactly. Yeah, to kind of speak on that, yeah, communication with your vendors, super important. That's key, definitely.
Yeah.
A great opportunity to talk about Darby here too as well. I mean, they worked really, one of the things that we liked about our partnership is they worked intelligently with their customer base to make sure that they were adequately staffed. And their primary concern was taking care of the people that they were working with, not people who had called out of nowhere, out of the blind. So I know from talking to Darby clients that was really appreciated.
Yes, it has been amazing how everyone forgot about business development, adding another customer. They made sure the people who have been with them, they're well taken care of. So keep talking with your vendors. They're being very resourceful. Really impressed with all of them, actually.
Yeah, I want to, Dr. Kaur and Cobo, thank you so much. This is a tremendous program. Really appreciate everyone's involvement. We had a terrific retention rate through the full hour here. I want to remind people, if they're interested in additional educational content from Darby and CareStack, that you go to our respective LinkedIn pages. That's the best place to find information on upcoming programs. Follow Darby, follow CareStack on LinkedIn, and that's where you're going to get most of the up-to-date information on our webinar series. We're really trying to step up the cadence, the frequency of these programs. So I want to thank Dr. Kaur, Cobo, really appreciate your time. And as a reminder, everyone who's registered for today's webinar will receive a link that allows them to access a recording of this program. So stay healthy, be safe, and hope to speak to you on the next program here on Thursday of next week.
Thank you so much, Jim.
Thanks, everyone.
Thank you, everyone.
Yeah, well, thank you. Okay.
Bye-bye.
Take care. Have a good Friday.